All right, why don't we get rolling? So welcome again, everyone, to today's Hot Topics in Research Ethics webinar. We're delighted to co-host the webinar as the collaborative of the Johns Hopkins Berman Institute of Bioethics, as well as the University of Malaya Faculty of Medicine, under a Fogarty-funded training grant to support research ethics training in Malaysia. I'm joined today by colleagues from Malaysia and University of Malaya, as well as from Johns Hopkins, to introduce our speaker and topic today and moderate the discussion. So for those who haven't joined prior webinars in the series, we do have several that have been offered over the past year and a half. And they're all archived on our program website. We'll drop a link to that in the chat momentarily so you can access those recordings if you're interested. But just a brief word about a new, relatively new now, a few years in, Master of Health Research Ethics training program that we jointly developed. This is a one-year full-time master's training program in research ethics hosted by the University of Malaya. There's an application intake every year, and the session is scheduled to begin every September. The program aims to equip students, graduates, with knowledge and skills that are necessary to take on this topic area of research ethics and engage in the field in various professional ways. And as I mentioned, we've had an opportunity to have support from the Fogarty International Center of the U.S. National Institutes of Health, which, among other things, allows us to support scholarships for up to 10 trainees per year to enroll in the program from low- and middle-income countries in the Southeast Asia region. So we welcome applications every year from anyone who's interested. With that, let me just offer a few ground rules for the webinar before handing off to my colleague and the co-principal investigator of the training grant, Professor Adiba Kamarulzaman. So like most webinars that I'm sure you've participated in, we invite you to type any questions or comments that you might have in the chat box or the Q&A module, and we'll take them in turn after our presentation today. We'll have about 45 minutes for presentation, followed by 15 minutes for question and response. We're recording the webinar just for your information so that we can post it, as I mentioned earlier, and archive it. If you have any questions, feel free to reach out to me or anyone else who's listed as a presenter within the chat, and we can help you in the event that you do have an issue. With that, and not wasting any more time, let me hand off to my colleague, Professor Kamarulzaman, so that she can introduce today's speaker. And we're very grateful, Dr. Suleman, to be having you join us today. So, Adiba, over to you.
Thank you very much, Joe, and good evening from Kuala Lumpur, Malaysia, everyone. I'm very excited to introduce our speaker for this evening, our time, and morning in London, and also for afternoon in London and morning in the US, most parts of the US. We have Dr. Mehrunisha Suleman, who is currently the Director of Medical Ethics and Law Education, the Ethos Center at the University of Oxford. She has a number of qualifications to her name and is eminently qualified to speak on this topic tonight. Not only does she hold a DPHil in Population Health from Oxford and a BA in Biomedical Sciences from Cambridge, but she also has an Alamiah degree in Traditional Islamic Studies and was awarded the 2017 National Ibn Sina Muslim News Award for Health. She's an expert for UNESCO's Ethics Teacher Training Program and is a council member at the NAFIL Council on Bioethics. Her research has been on numerous things, but including genomics, Islamic ethics, and public engagement towards bridging the knowledge and communication gaps, and is a co-lead on the GLIDE project as well. So, Dr. Suleman, we're very excited to hear you speak today. Over to you.
Professor Adiba, Joe, everybody who is part of this fantastic collaborative, thank you so much for inviting me and having me here as part of your program and giving me the opportunity to share some work that I did as a DPHil student. It's an area of particular interest of mine, thinking about how it is that Islam and the faith commitments of Muslim researchers, research ethics committee members, guideline developers plays out within the forum of research ethics. I will be sharing some slides, and what I will do is try and do the most difficult thing of this evening, which is try and share my screen. I did the worst thing before this session, which is do lots and lots of updates. And I wonder whether it might not let me, but let me try. If not, what I will do is I will email my slides to you, Adiba, and that might be the easiest way around. Many, many apologies. This is the worst thing to do before a seminar, to try and run it off updates. Adiba, I'll just email it to you now. Okay, it's floating through cyberspace, but what I can do is begin with an introduction, which is telling you a little bit about the work itself and where it emerged from. The title of my DPHil was predominantly Islam and Biomedical Research Ethics, and this talk is about the moral universe of Muslim researchers. How did this work come about? As a medical student, I spent a considerable amount of time in Zambia, where I was born and I grew up. And at the time, it was sadly the middle of a different sort of pandemic, HIV/AIDS. And Zambia at the time was suffering from HIV/AIDS considerably, where almost 33% of the population were infected. And so a lot of the work that I was doing during my summers in Lusaka, the capital, was working with nursing students, nursing colleagues, as well as medical students, to try and do outreach work, predominantly around barrier contraception, but also HIV/AIDS awareness. And one of the things that we became familiar with very, very early on was the sensitivities in cultural understandings of the disease, not just amongst people out in communities and rural settings, but also amongst healthcare professionals themselves, nursing colleagues with very deeply held religious commitments who are concerned about the public health intervention and associated data collection and research around barrier contraception, which really got me thinking about the role of international guidelines, international standards that come into potential encounter with researchers' own faith and cultural commitments. And so what I wanted to do was set up my work to look at how it is that research is done in not just low and middle income context, but particularly in the context of Muslim majority countries. And so that's what I set out to do. Routledge very kindly published some of the findings of my DPHil research in this volume that I'd be very happy to share excerpts of for those of you who are interested. Adiba, I'm going to do the very annoying thing of saying next slide, please. So what I'll do is I'll tell you a little bit about the project itself, a summary of the methods, because I'm hoping there'll be a few of you who are students on the master's program that Joe just mentioned, as well as budding PhD students. I won't be going into the rigorous detail of the methods. They are in the volume, and I'd of course be very, very happy to talk about it in the Q&A or separately in a discussion with you one-to-one. As you can imagine, there are not many people who have done work or are doing work around Islam and biomedical research ethics. So I am looking for willing victims as peers in this endeavor. So please do feel free to email me and reach out. Sadly, I can't summarize 4 years of work in 45 minutes, though I will give it my best shot. But what I will do is try and summarize the key findings and really drill down into one aspect of the work that was pertinent in both of my case study sites, Malaysia and Iran, and that's around autonomy and consent relating to female participation. And I'll give you the backdrop of female consent in Muslim societies, and also look at the role of scripture and scriptural reasoning when I spoke to a lot of the research participants in my case study sites. And I will try and finish early to give us the opportunity for any questions. But I know there is a raise hand function and there is also a chat function. So I will look to Joe and Adiba to interrupt me if there are crucial questions. You know, if halfway through or a couple of slides and you feel, gosh, I don't think I can understand the remainder of this talk unless I get clarification on X, Y, and Z, please do stop me, or do unmute yourselves, or do raise your hands. I'm more than happy to be interrupted. Adiba, next slide, please. So why is this question of Islam and biomedical research ethics important? Other than the backdrop that I gave you about people's faith being important within not just healthcare, but healthcare research, it's critically important that we look at the broader picture. And as a public health person, I can't but help turn to demographics. And the first is that a really important piece of work that was done by the Pew Forum projects that by 2030, Muslims will make up 1 in 4 of the world's population. And what that means is that that's a significant number of the population either being subjects of research or carrying out research themselves. And so it's important that we think about the role of Muslim researchers and research subjects' faith on their research encounters, but also the more strategic questions around the role of religion in clinical research and how research priorities are chosen, how research is conducted, and the relevance of guidelines in different contexts. Many of you will be familiar with international guidelines like SIOM's Declaration of Helsinki, the Nuremberg Code. And one of the things that I was critically interested in is how does the transportation of guidelines like these play out in contexts where other religious and cultural commitments are important. The other aspect that I was interested to look at is the implication of personal faith commitments and how they play out, be that the role of Muslim researchers and the sorts of challenges that they encounter, but also for researchers who aren't Muslims, who have other faith commitments or none. And when they encounter participants with particular faith commitments, to see how those play out. Adiba, there's a comment that we're seeing the presentation in editing mode. So am I. I think we might need to return to presenter view. Thank you so much for the comments in the chat. Oh, Adiba, we can't hear you. Sorry.
I'm really sorry. I don't know what's happened to my screen. It seems to have paused. Keep talking and I'll try and fix this.
No worries, no worries. I can do just by seeing the prompt. For those of you, I can make these slides available, so don't feel you need to take copious notes or worry that they're not accessible currently. In terms of the methodology of the research, as any good PhD student, I started with a rigorous literature review as well as a review of guidelines. So I'll tell you a little bit about the literature review and then go on to the guidelines. I did a systematic search of the most popular databases to try and understand what has been published on the role of Islam as well as Muslim majority contexts relating to biomedical research and biomedical research ethics. And there was a few hundred relevant studies that I looked at in further detail. I have to acknowledge the Georgetown University Library in Qatar, who did a wonderful job of giving me access to materials that weren't available in Oxford, as well as the interlibrary loan system that made a lot of resources that were available in other languages or overseas available for me to review. And the literature, unsurprisingly, was sparse on this subject. What I found was there was a lot that has been written and produced on the role of Islam and the faith of Muslim physicians within the clinical context. Whereas when we broaden that out to the context of research ethics, there is very, very limited information. And the little that has been published revealed disagreement, particularly around women's consent. There were a few papers that said, when it comes to women's participation in research, there should be no difference to that of male participation, and the autonomy of men and women is considered equal within the Islamic tradition and within Muslim contexts. However, there were a handful of papers that disagreed with that account and said that within the Islamic tradition, there is a recognition that men are guardians, and because of this guardianship role, it is important to defer to male guardians when it comes to enrollment of women in research. There were other guidelines, the adaptation of the SIOMS guidelines by the Islamic Organization of Medical Sciences that has also been commented on in the literature. And there it did acknowledge that the autonomy of men and women is considered the same in Islam, but that the unitary recognition of autonomy, which is predominant within the secular paradigm in Europe and North America, is at odds with that of not just in the Muslim world, but in other parts of the world where familial relationships and relational autonomy is a critically important one. And so it does advise researchers and research institutions to be thinking about this aspect of relational autonomy, particularly when it comes to female consent. And I'll come on to this this exceptionalization of women's autonomy in the literature and guidelines when I talk come back to some of the qualitative data. So that's sort of the highlights from the literature. In terms of the research guidelines, what I did was I tried to systematically obtain research guidelines from all of the countries that align themselves with the OIC, or the Organization of Islamic Cooperation. That's how I defined the Muslim world. And of those countries, I found that a handful did have very rigorous research ethics guidelines. A few did have research ethics guidelines, but they were sparse in terms of the protections that they included. But those, particularly from the Middle East, such as Saudi Arabia, but also countries like Pakistan, had a clear emphasis on the role of religion in the authorship of the guidelines, but also in the clauses and sub-clauses of guidelines, particularly when it came to research and implementation around assisted reproductive technologies, but also more broadly, principles that would mean participants would have to spend time away from the home, particularly women, or if it would impact their reproduction. There was stipulation about how it is that such research ought to be conducted. But again, there was, I would say, overall a limitation, in terms of a detailed description of how it is that day-to-day research ought to be carried out, and how people's faith and the role of Islam, both as a religious tradition, as an overall deliberative authority of moral challenges and questions, ought to come into play. And so, because of these limitations in the literature, as well as in the guidelines, and the sorts of ambiguity around female consent, I was keen to do a qualitative study to accompany this preliminary research. And I systematically reached out to all of the countries within the OIC. Understandably, very few of them had the infrastructure in place to support a PhD student. A few were skeptical about what a nosy PhD student would want to be doing, speaking to researchers and healthcare professionals about their faith. But I very, very kindly received very positive feedback from Malaysia as well as Iran. And so I set out to carrying out my case study research in the two countries. I also have to acknowledge that I received approval from Uganda, but limitations in terms of time and resource meant that I did have to limit my work to Malaysia and Iran. For those of you who are interested, in terms of how it is some of these findings may well relate to countries like Uganda or others in Africa, I'd be very, very happy to speak about that, because a few colleagues have spoken to me about the sorts of questions and challenges that they face in their context that I can relay thanks to their insights. And so what I did was I spent 10 weeks in Malaysia, and half of that time in Iran, speaking to researchers, research ethics committee members, guideline developers, as well as religious scholars, to understand the role that Islam plays within their setting in influencing what's considered an ethical problem, and if an ethical problem emerges, how it is that it is addressed. I'll give you a little bit of a backdrop about the two countries. Of course, my hosts based in Malaysia are a lot more well-placed and informed to tell you about their context, but I'll share with you a few insights. So Malaysia is constitutionally acknowledges Islam as the religion, but its overall legal system is secular, though the application of Islam, particularly when it comes to personal disputes or matters, can be implemented at the state level. Comparatively, in Iran, since the establishment of the Islamic Republic in 1979, not only is Islam considered to be the national religion, but the involvement of scholars is formal throughout the legal process, not only in the courts, but also within the biomedical system. So I had the fortunate invitation of being welcomed into Qum, the seminary in Iran, where most of the religious scholars and specialists are based, and there's a specific department that's been set up to review advancements in healthcare, as well as ethics related to health and health research. And I had the wonderful opportunity to speak to experts there, and they spoke about the formalization of their involvement in the deliberations. Comparatively, in Malaysia, involvement of Islamic scholars within research ethics committees is on an ad hoc basis. It's on a need-to-know basis, and a lot of the work that gets done is in alignment with what we would recognize as guidelines within Europe and North America. And so researchers that I spoke to said that, if there are issues that may well raise questions pertaining to religion that require careful ethical deliberation involving a religious scholar, then they're able to call up a scholar and review the relevant cases. There are limitations to that, in that it requires researchers themselves to be familiar with what may well require religious adjudication, but also that if matters arise within the undertaking of a research proposal, it becomes more difficult to then get the necessary expertise on board, or there may well be a delay. The other issue that I that I learned about from researchers was social science researchers who are keen to do research, particularly around HIV/AIDS, with marginalized groups such as sex workers or men who have sex with men. They say that they find considerable difficulty in getting research ethics committee approval, and one of the reasons given is religious sensitivities around conducting such research. And so what can occur is that such research is conducted, but when it comes to journal publication, they often face challenges in publishing their research because they haven't obtained research ethics approval. So that's, some of the examples that I came across in terms of the difference in how it is that religious authority is organized within the two countries. I mean, in terms of the overall summary of the DPHil research, I found that Islam and its institutions do have a role to play in ethical decision-making in the day-to-day practice of researchers and research ethics committee members, both within Malaysia and Iran, and that a lot of the sorts of lessons that can be gleaned from the research can be transposed to countries like Pakistan, Indonesia, and Saudi Arabia that have Muslim majority contexts, and that within this religious authority, be that on an ad hoc basis or through Sharia councils in Malaysia or through a more formal structure within Iran, there are distinctive mechanisms that are in place, predominantly ijtihad or independent scholarly reasoning, as well as the production of fatwa or legal edicts. And this is really important when we think about the current pandemic. Early on in the pandemic, there was a lot of disagreement about the implementation of restrictions, the suspension of Friday prayers, as well as the offering of congregational prayers within the month of Ramadan in countries like Pakistan. And scholarly authority had a huge role to play in interpreting and understanding public health measures. And so we can see that religious authority has a crucial role to play in healthcare decisions and the deliberation of some of the questions that are live in this current pandemic. The other important finding within the DPHil research was that pandemics like HIV/AIDS pose major challenges to the world of Islam, and this is because of the sorts of questions around the implementation of needle exchange programs for intravenous drug users. Drug use is considered haram or illegal in Islam, as well as extramarital affairs, and within the majority of Islamic scholarly opinion and lay Muslim opinion, same-sex relationships. And so all of those socio-cultural contexts mean that Islamic scholars need to deliberate how to tackle the implementation of measures to curtail pandemics like HIV/AIDS, and also to approve necessary research and the dissemination of data. A lot of stigma associated with practices and behaviors related to HIV/AIDS requires careful negotiation about how it is that such data ought to be disseminated, and the practices of that sort of data handling has been starkly different throughout throughout the Muslim world. Other than these sorts of systemic issues about Islamic scholarly authority and the implementation of ijtihad and fatawa, is the individual deliberation from researchers themselves, and also the sort of the practical example of deliberating women's autonomy, and the particular interface of research, religious tradition, and pre-existing socio-cultural norms, which I will come on to in more detail. For those of you who are interested in broader questions about HIV/AIDS, as well as the role of religious scholars and religious authority, I'd be very, very happy to talk to you about that separately. But I do want to delve into more detail about this issue of women's autonomy and how it plays out within these two contexts in the interest of time. Adiba, next slide, please. Oh, we can go on to the next slide too. So just to give you a little bit of a background, I told you a little bit about the literature. When I spoke to researchers in both Malaysia and in Iran, researchers said that they found it very difficult to balance their professional training, which was predominantly rooted in consenting women individually for research, versus what they found as being important within their local context, as well as what their learning was, or their commitments were in terms of their religious tradition, in terms of respecting the views and objections of male spouses. For researchers who weren't Muslim, they also found themselves in a position of uncertainty, in not being sure of how to reconcile Muslim women's own views about wanting to consult their husbands, but also trying to ensure that women themselves were sufficiently informed and empowered to independently enroll into research. And there were other researchers that didn't face such challenges and didn't feel that religious or cultural views about the role and status of women were important. In fact, some said they were unwelcome. You know, they thought that they were unhelpful and meant that such views posed challenges on how it is that they understood women's autonomy and how they understood their role and obligations as researchers. Adiba, next slide, please. So just to give you a flavor of what some of the researchers' views were, this was a very senior researcher and research ethics committee member and guideline developer that I spoke to in Malaysia. And he said, when you think about informed consent, if we are to strictly refer to the Islamic paradigm, then a wife ought to get the permission of her husband to leave the home. This is an Islamic concept, and I'll come on to some of the verses and some of the underlying concepts that this relates to. And many of the participants quoted from the Quran or tradition of the Prophet Muhammad to support their, sorry, just getting a bit of a dry throat, to support their views. And one of the verses, a very famous verse from chapter 4, which is Surah Nisa, or the chapter of the woman, verse 34, it says, men are the protectors and maintainers of women. And what he explained was that although this has been interpreted in many different ways, in an Islamic household, so one that is considered to be following the Islamic paradigm, the buck stops with the husband. He is the responsible person. And so even if you want to go out of the house, you have to ask for permission. And this is critically important as the backdrop, because many researchers spoke about their own commitments to this verse. Many researchers spoke about female research participants facing hesitancy, moral anxiety when enrolling in research that they thought would be uncomfortable or would be something that their husbands or their families would disagree with. So it's incredibly important that we take stock of this as the backdrop. Adiba, next slide, please. Thank you. A really important complement to that view was one expressed by a researcher in Iran. He was based in the city of Isfahan, which is considered religiously conservative in Iran, and he spoke very eloquently about the challenges that he saw feminism poses to Iranian society and to Islamic values that he understood. And he said that feminism is against Islamic thought. He said, in Islam, we study the Quran, there isn't feminism or manism. He spoke about how, in the eyes of God, spiritually, men and women are equal in Islam. But what he says is that there is, of course, a difference when it comes to the social role of men and women, as well as the domestic role of men and women. And he says within their social roles, men and women are equal, but within the domestic roles, he explained that it's important for us to consider the differences between men and women. And both the man and woman has a lower autonomy in their household because of what they have to collectively do for their family and for their relationships. But overall, the man has that responsibility, and this is to evoke harmony. And he was very he was very committed to explaining this overall paradigm within the Islamic tradition as he understood. Adiba, next slide, please. As I grew to discover with my discussions with a lot of other researchers, a lot of other research ethics committee members and guideline developers, views are plentiful, and particularly for the female researchers. And this is an example of a female researcher. She said that this notion of men having guardianship or an element of superiority that means there is a deferral to a man's decision in the household or in terms of family decision making. She explained that this is not true. She disagreed with this, and she says that this is a way of undermining the responsibility and the status of women. And she said that often when researchers deferred to male spouses, it was because they were afraid of litigation or afraid of challenges or withdrawal from research studies. It was less to do with any religious interpretation or religious commitment, and it was more to do with the socio-cultural understanding of how it is that such disagreements may play out. And so this was something that I also found really important to document and to understand more fully. Next slide, please, Adiba. So what I did was I took away my 50+ interviews and had a very long think. And I also went back to the source texts, both the verses of the Quran as well as relevant traditions of the Prophet, to really try and get an understanding of what the role and status of women is in Islam. And there are, of course, a plentiful literature on interpretations of the Quranic verse that I outlined, particularly this word qiwama that is interpreted as superiority as well as wilaya or guardianship, and also concepts around disobedience, this issue of whether a female spouse is disobedient if she leaves the home without her husband's permission, and also an extension of the verse 434 that says that if a female spouse is found to be disobedient, then she can be physically rebuked for this. And this verse, as you can understand, and many of you may be familiar, has been interpreted and reinterpreted numerous times, and still is a subject of a lot of scholarship. And there's been wonderful work that has been done on this throughout the ages. And some of the work I highlight here, interestingly, a scholar in the States, Khalid Abul Fadl, very renowned Islamic scholar and expert in both the Quran and Hadith literature, says that there are numerous translations to this issue, this word, this concept of men are the protectors and maintainers of women. He says this isn't what the Quran means at all. Because of the elevated status of women in Islam as childbearers and mothers, men are required to financially provide for women and also sustain the family. And if anything, the Quran isn't referring to men as being guardians or protectors of women. Rather, he says that men are the slaves of women. They have to do everything possible to provide for them, and women aren't obligated to work or to bring in any sort of economic contribution to the home. And so he challenges this construct entirely, which I think is really, really interesting. Amina Wadud, very prominent feminist writer, talks about a lot of these terms, but particularly refers to this concept of daraba as not meaning physical retribution, but for spouses to turn away from one another, giving time for reconciliation. And she explains that those who interpret daraba as physical retribution are not thinking about the verse in a holistic way that is committed to the overall lessons of the Quran relating to adl and ihsan, or justice and excellence. So I do recommend some of her writing as being really interesting in sort of adding to the overall bioethics feminist literature. Another scholar who's based in Oxford, Ziba Mir Husseini, she argues that the earlier interpretations of the Quran as well as the Hadith literature has to be understood within the context within which these were written, and these were predominantly patriarchal societies. And so a lot of the scholars read these verses in light of the societies within which they lived. And so a lot of these verses need to be interpreted in light of our current context. So all of these are really sort of really important, really interesting, and ones that I'm flagging because they became necessary for me to look at as I was looking at my data. Next slide, please, Adiba. I will try and wrap up very, very quickly, but what I do want to mention to you is the sort of the deep dive that I did in trying to understand the implications and disagreements around female consent and female autonomy, as well as the potential issue of patriarchal interpretations of the Quran, which is the challenges researchers face when they're trying to do work around domestic and intimate partner violence, as well as research on women's sexual health and sexual experience. And I'll share the quote of one researcher, but I'd be more than happy to talk about the experience of other researchers and the context more broadly within the Q&A. Adiba, next slide, please. So what the researcher explained to me was that as somebody who's been doing a lot of work in intimate partner violence, she's very committed as a public health expert, as a social science researcher, as an advocate in community, as a member of her community to do this work. What I learned very quickly from her experience was that relying on international research guidelines or even national guidelines was a limitation for her. What she was required to do was to draw on multiple moral resources that were part of her identity as a social scientist, as a public health person, as an advocate, as an activist, as somebody trained in the Islamic sciences, as well as a woman and a member of her community, all of these hats that she was wearing. And so her moral universe was one that was incredibly plural, not one that was limited by dichotomies such as universalism and relativism that are rife in the literature, but something that required very, very careful negotiation of a lot of the different values and different resources that she was coming across. And one of the things that she spoke of with a degree of emotion was how she encounters women in the homes when they have faced both physical, emotional, and intimate abuse from their husbands. And she said that this wasn't just limited to Muslim women. It's something that she faces with Christians, with Hindus, with women of religious traditions and none. And what she says is, how do I speak to survivors about obedience when a lot of these women have a very particular interpretation of their religious and their cultural traditions, where obedience is a critical issue, keeping private matters in the home is a critical value and a commitment for them. Adiba, next slide, please. And what she explained is that a lot of these women believe they must obey their husbands. And she spoke of the difficulty that she faces in trying to, of course, be an objective researcher, but finding this very morally distressing circumstance where, as a person who is learned, she could impart some understanding of the religious tradition and some of these different interpretations that I shared with you. And she says, you know, will they just get stuck with that knowledge? Shouldn't we engage them with this dialogue about this whole idea of obedience? As a researcher, if you know you just don't want to engage with them with this dialogue, then do you just leave them and carry on with the research, or do you provide them with this broader additional understanding? She tried to get additional resource, additional support, which wasn't provided. She tried to consult with religious authorities to try and get them on board to support this sort of research. Sadly, no such luck at the time that I spoke to her. And so what her experience highlights is this very sensitive, very difficult reality that researchers face. But of course, the principles that are set out within research ethics guidelines are an important tool to begin with, but that researchers like herself require moral spaces and support to enable deliberation of religious and cultural values that she holds, as well as her research participants and the wider community within which she works. I'll stop there, Adiba, because as you can see, I can talk ad nauseum about my work, but I do want to give the opportunity for questions and wider engagement.
Thank you so much, Mehrunisha, for that incredible work, trying to tease out the very, very difficult balance between, you know, the moral universe of these and the Islamic traditions and the kind of research that we want to do. Did I see a question? It's more of a comment about Amina Wadud. Do we have any questions? If any of you do, please raise your hands the Zoom way. But I might kick off, Mehrunisha, you know, in the course of our HIV/AIDS research, we've been focusing on people who inject drugs and MSM and colleagues also working with transgender and cisgender women. I was struck by what you said about, you know, the self-censorship that goes on with some ethics committee, which I'm actually aware about in Malaysia, in terms of doing research with these key populations that are deemed to be, you know, that are morally sensitive for Islamic scholars, which I have not found to be so in my university. Do you think perhaps in our place it's not so mono ethnic as it is in some other university? Do you think that might have something to do with it?
That's a really good question, Adiba. I think that might be partly the reason, but I think some of it is also to do with the composition of the research ethics committees. So I'll try and explain that. So the first thing that I found in Malaysia was a difference in approach to needle exchange programs versus the use of barrier contraception. I spoke to a lot of researchers and research ethics committee members that were that did say, look, intravenous drug use is wrong in Islam, but this principle of darura or necessity means that we ought to provide this as a service. And I spoke to scholars and they said the same. You know, there is this overarching
bigger purpose of Maqasid Sharia, which indeed, was how we approached it. Yeah,
absolutely. So the issue within the sort of the commitment within the Maqasid of protection of life means that we should be providing these sorts of services, and that's how they explained it. And so when I asked this secondary question of, well, can the same principle be applied to barrier contraception? They said, well, no, that's different. And when I wanted to understand why that was different, it became very clear that there was a difference in understanding of the forbidden nature that was intravenous drug use versus intimate relationships outside of the parameters of marriage. And so that was something that was very interesting. That's I've sort of delved into more detail in my writings, but it does speak to, again, these sorts of personal commitments of researchers themselves, that they're able to maybe negotiate one conflict, but not necessarily another. Why it is that there's a difference between the two, that's work that I do want to do in, you know, as a follow-on, you know, and setting up these sorts of moral spaces, getting researchers, scholars all in one room to try and really understand, are these to do with sociocultural stigma, or is there something distinctive within the legislation or within the moral architecture of the tradition that means these are considered legally different?
Yeah, thank you. Anyone else might have a question?
Oh, I think there's a raised hand.
Okay, please just because
Firdaus, do unmute yourself and contribute.
Hi, Mehrunisha.
Hey, lovely to hear your voice. How are you?
I'm good. Good to see you again.
You too.
I'm very interested with the last slide that you shared with us, with the interview number 25. So I just wonder, what was the discussion in your thesis? What are your thoughts on that? The fact that the researcher has a dilemma, whether, you know, how to proceed with such a difficult situation, you know, dealing with the disobedience issues among women, and then, you know, whether that's the right thing to talk about or not with women, especially in the current context. So I'm just wondering, what was the discussion in your thesis?
Really good question for this. I mean, thank you so much. It's lovely to hear your voice. Always wonderful.
Likewise.
With old friends. It's a really good question, and sadly, a very difficult one that the researcher had struggled, in sort of explaining and expressing, and not just her, a few other researchers who are working in the area had said that they really struggled to find the necessary support. And I think that's important for me to highlight before I go on to explaining what subsequently ensued. And the researcher explained that in a couple of circumstances, she did try to engage women in conversations about their religious beliefs and their understanding that they have to keep things private, and that their being subject to abuse was something that was part of what they had to accept. And she tried to begin conversations with them as she tried to explain to them what her understanding was and some of the resources and the lessons that she relied on. Sadly, what she explained to me was that it was very, very difficult for her to continue those conversations because she didn't have the resources, nor she quickly realized the training to really deal with the fallout, the sort of emotional trauma that these women would be facing. But for many of them, she explained that holding on to these religious commitments were, in a sense, a coping mechanism for them. And by undoing those, she didn't realize that they would need a lot of psychological support alongside her work. And as she tried to quickly sort of renegotiate being able to put in place those sorts of resources and those structures, she ran into considerable systemic barriers and disagreement about the type of work that she was doing. So it's sadly, not a story of resolution that I can share with you. I do hope that they have managed to do the work subsequently, but I'm yet to know that, so I can't share that with you.
All right, thank you so much. Thanks, Mehrun.
Any other hands? Mehrun, going back to your extremely interesting work on the restrictions on women. So the patriarchal interpretation of the woman and male and female sort of power balance, if you like. How much is it cultural, and how much is it really religion? The two countries, my own and Iran, the researchers that you interviewed, I think Malaysia has been getting more and more conservative as we speak. Do you find this in other countries where perhaps it's less conservative, that interpretation? Seems to even sort of play out in the research field, yeah?
Really good question, Adiba. How long do I have? Because I could talk about this for a very, very long time.
You have 3 minutes.
3 minutes. Okay, wow. 3 minutes to summarize the history of Islam. Excellent. So when I am asked this question, I do suggest that it's important to take a step back and think about the context of revelation. When the Quran was revealed to the Prophet Muhammad, and the status of women at the time. And it was at the birth of Islam, it was the first time that in that society women managed to retain their financial property, inherit. They were burying female children alive at the time. And so Islam was considered to be a paradigm shift for that society. And even during the Prophet's lifetime, a lot of women were on an equal footing in terms of their their recognition as learned women, as contributing to strategy, be that
Khadija alayhi salam herself, right?
Absolutely, politically, in terms of warfare, etc. And also within the earlier generations of Islam. A teacher of mine, Dr. Akram Nadwi, or Sheikh Akram Nadwi, who is based in Oxford, says that it was when we moved away from sort of directly sourcing the Quran and Hadith and began to formalize jurisprudence, that the status of women began to be challenged and the subjugation of women occurred. And so we can see that it's through legalization that we see this transformation within Islamic history. And you continue to see cycles of that as we see states that want to legislate in a particular way. There does seem to be an emphasis on restrictions of autonomy of women. And this isn't, again, limited to Islam. We can see in countries like Poland or in states like Texas, when we look at laws around termination of pregnancy, for example, this issue of legislating around women's autonomies and freedoms is you know, a rife conversation today.
Thank you for that. I'd love to continue this conversation. Maybe we can take it offline and Zoom, but you know, it's been a wonderful discourse. Thank you so much. You know, you're welcome to come back to Malaysia anytime. We've got heaps of material for you, and I'm sure there'll be others who would love to join in to tease out some of these ethical issues, both, you know, on a clinical level as well as research ethics. So thank you very much, Mehrunisha, and thank you everyone for joining us today. We have 3 more hot topics for you for this cycle. So stay tuned for the announcements. Thanks everyone, and good night.
Thanks very much.
Good day.
Thank you all. That was lovely.